Comprehensive assessment of the skin domain in CHC assessment. Is the individual's skin intact, or is there evidence of compromised skin integrity such as redness, irritation, wounds, or ulcers? If compromised, how extensive is the issue and what areas of the body are affected? If the skin is compromised, what specific skin issues are present, such as pressure ulcers, open wounds, bruising, rashes, or skin tears? Are there any pressure ulcers present? If so, what category do they fall into based on the NHSI classification? Category 1-4, deep tissue injury or unstageable. If pressure ulcers or wounds are present, what is their size, location, depth, and level of severity? Are the wounds improving, remaining the same, or deteriorating despite interventions? Are there any signs of infection in wounds or ulcers, such as redness, swelling, heat, pus, or an unpleasant odor? Has an infection been confirmed through wound swabs or cultures? And if so, what treatment has been initiated? Have antibiotics, antiseptic dressings, or other treatments been prescribed for wound care, and how effective have they been? What is the individual's risk level for developing pressure ulcers based on a formal assessment tool such as the Waterlow score? If the individual is at high risk, what preventive measures are in place to protect skin integrity and prevent further deterioration? Is the individual able to reposition themselves independently to relieve pressure, or do they require assistance? If assistance is needed, how frequently is repositioning carried out and by whom? Is there a specific turning schedule in place, and is it being followed consistently? Is an air mattress or other pressure relieving equipment in use? And if so, what type? If pressure relieving equipment is in place, is it functioning properly and set up correctly for the individual's needs? Are additional aids such as pressure, cushions, heel protectors, or specialist seating used to minimize the risk of skin breakdown? Are any environmental factors contributing to skin breakdown, such as prolonged bed rest, friction, shearing forces, or excessive moisture? Are there previous records of skin breakdown, and what has been the pattern or history of recurrence? What nursing interventions are in place to prevent or manage skin breakdown, such as regular skin checks, repositioning, and use of skin protectants? Are prescribed creams, barrier creams, or emollients being used? If so, what type, how often are they applied, and who is responsible for their application? If a specific dressing regime is required for wounds or ulcers, what type of dressings are used? How frequently are they changed? And who manages this process? Have any wounds required debridement? And if so, what method was used, e.g., surgical, enzymatic, mechanical, or autolytic debridement? Has the individual been seen by a specialist, such as a tissue viability nurse, TVN, wound care nurse, dermatologist, or another relevant healthcare professional? How does skin integrity impact the individual's ability to carry out activities of daily living, ADLs, such as bathing, dressing, repositioning, or mobilizing? Does pain associated with wounds, ulcers, or skin conditions affect the individual's movement, comfort, or sleep? If pain is present, what measures are in place to manage and relieve discomfort, such as pain medication, positioning techniques, or alternative therapies? Does the individual's level of mobility contribute to their risk of skin breakdown? And are they able to reposition independently or with assistance? Have physiotherapy, assisted movement, or specialized positioning techniques been considered to improve mobility and reduce the risk of skin damage? Has the individual's nutritional status been assessed in relation to skin health? Are they receiving an adequate intake of protein, vitamins, and hydration to support skin integrity and promote healing? Are any dietary supplements, fortifications, or specific nutritional interventions in place to enhance skin healing and prevent further breakdown? If the individual is experiencing poor hydration, what measures are in place to ensure adequate fluid intake? Are external factors such as friction, shear, or prolonged exposure to moisture contributing to skin breakdown or irritation? If the individual is incontinent, is there evidence of moisture-associated skin damage or incontinence-associated dermatitis? What measures are in place to protect the skin from moisture-related damage, such as incontinence products, barrier creams, or frequent hygiene care? Is there a detailed care plan outlining preventive measures and treatment strategies for maintaining skin integrity? Are there regular skin checks documented in care plans or nursing records to monitor for early signs of deterioration? Has a district nurse, tissue viability nurse, TVN, or wound care specialist been involved in assessing and managing skin concerns? And what recommendations have they provided? Are GP records, specialist assessments, and care plans up to date? Regarding skin health and wound management, are carers and staff adequately trained in pressure area care, skin integrity maintenance, and wound management? Are turning charts, wound care documentation, and monitoring records being maintained consistently to track interventions and progress? Is there ongoing monitoring and reassessment of skin integrity to adjust care as needed? Are there any early warning signs of further skin deterioration that require intervention, and have these been documented and acted upon? Has the effectiveness of current interventions been evaluated, and are any changes needed to improve outcomes? Is the individual satisfied with their skin care, or do they have any concerns or preferences that should be considered? Is there a risk? Management plan in place to address potential concerns related to skin integrity, ensuring that proactive measures are taken to prevent further skin breakdown? Please share your thoughts in the comment section below.